And then switching gears a little bit about the immune system, I already covered this, how the cancer cells and the immune cells play this hide and seek. And if the immune system is on top and kill the cancer cells, then you don't know that you've even had baby cancers. And but by the time when patients come to see us, doctors, the immune system has given up and the cancer cells have had upper hand. Now we are trying to figure how they dodge the immune system and go after them with drugs like PD-1, PD-L1 inhibitors. I do want to make a very quick point here. This is very specific, the immune system's effect to the cancer cells. This does not mean somebody who has got lung cancer or any cancer, their immune system is weak, or the immune system is not good enough, or they cannot fight infection, none of that stuff. It's specific to what's happening within the tumor. So patients with lung cancer, for example, their immune system may have let them down and allowed the cancer to grow within the tumor cells. The immune system may have let its guard down, but they are able to fight infections like every other person, unless they are going through chemotherapy and the blood counts are low or something. But they are able to do or handle infections and other things well. So their immune system is fine. That's why I'm a little worried when my patients ask me boosting the immune system, broadly, that doesn't work. We have to understand what part of the immune system let the cancer cells down and try to tweak that and make the cells rejuvenate. So talk to your doctors. Do not take any immune rejuvenators on your own, ordering from Amazon or some other place. So overstimulated immune system is not a good thing too. So just be careful about that. And there are many ways the immune system, the cancer cells dodge the immune system. We talked about the PD-1 and the CTLA-4, but others are being tested in clinical trials. Some are disappointing, some are promising. For example, the LAG-3 has become a routine form of therapy. Targeting LAG-3 has now become a routine form of therapy in melanoma. And in lung cancer, we're still exploring these things. The other part is creating vaccines. And basically, when the tumor cells grow, they have this, what we call the abnormal proteins or genes. We call them neoantigens. Neo means new, antigens mean that triggers the immune system. If you take a lung cancer, this is a work from small cell lung cancer, we haven't published yet. And we look at the small cell when we actually grind them and do the mapping of the genes and look for what's there on the cell surface and do fancy, bioinformatics analysis. It turns out that on average, there are 60 to 100 abnormal proteins or neoantigens in each tumor cells. And the same goes in lung cancer, non-small cell type 2. And there are significant number of neoantigens in the tumor cells as well, although less so in the non-smokers. But this is now a topic of research where we take out the tumors, and here is an example of a study we published, take out a tumor and map out the genes, find out what genes are altered, create a vaccines and inject them under the skin or on the muscles, and then try to make the immune cells create this new set of immune cells to go after these cancer cells. And that has shown some success in early studies. It's still some ways to go. And we are working on these things. So showing that we can do this personalized neoantigen vaccines, not to prevent cancer from happening, but to treat the existing cancer. It's still in the early stages. A number of these efforts are currently ongoing in almost various cancers. We also doing all these fancy studies, looking at the proteins, looking at the genes to see why do some patients not respond to immune therapy. The classic example is a gene called STK11. If you have that gene mutated, you don't do so well with immune therapy. And if you have the gene intact, you do better. And we now find that there are a number of proteins that are altered in these STK11 mutant tumors that may prevent drugs like pembrolizumab or Keytruda work against these cancer cells. And that leads to new set of research, new set of drugs, compounds. So that's how we make progress. And we are trying to tease out why is this not happening? Why some genes prevent the immune cells from working, immune system from working, or immune therapy from working.